So, Lori, maybe you remember me from last night. I'm Lee, and this is Ruth. And if it's okay with you, I'd like Ruth to stay and listen and learn while we finish your intake. Would it be all right if she stays? Or if it's not, that's fine. Just let us know.
No, it's okay. That's fine.
So, how are you doing? I heard your kids are having a great time making art in the playroom.
They didn't want me to go at first, but then they got comfortable. I told them I would keep checking on them.
Well, that makes a lot of sense. And if you feel like you need to jump up and check, that is totally not a problem. We can come back to this later, too. We're just trying to help in whatever way you all need support.
Thanks.
Okay. So, I know we started some paperwork with you last night, and we have just a little more to go over with you today. Basically, we talk to everyone who comes in about this. We give them this little card that talks about some of the other ways that a partner might try to control or hurt you in a relationship. Sometimes it's about your reproductive health. Many women who come to our program have experienced situations putting them at risk for unplanned pregnancies. And we want you to know there is a safe medication that you can take called emergency contraception. Some call it EC, or the morning after pill. Take it up to 5 days after unprotected sex to prevent pregnancy, if that's something that would be useful for you. Now, emergency contraception is available if you had unprotected sex without condoms or any form of birth control in the past 5 days, you had a condom break, get pulled off, or fallen off in the last 5 days, you've forgotten to take your birth control pills or change your NuvaRing or contraceptive patch in the last 5 days, or you're worried that your partner was trying to get you pregnant when you didn't want to be, messing with or damaging your birth control, like not pulling out when he said he would, or poking holes in your diaphragm. Now, are any of these things a concern for you today, or something you want more information about? Is EC or a pregnancy test something that would be useful for you today?
Actually, I was kind of freaking out about having left my pills at home by mistake. I really don't want to get pregnant right now.
Right. It totally makes sense that stuff you really need sometimes gets left behind. Actually, we have a public health nurse, Liz, that we work with, and she could easily bring pills over to the shelter today. So you don't have to go home to get them. And she can talk with you more about EC. Liz or any of our advocates can also talk with you about some of the things on the card in more depth. Methods of birth control out there that in the future your partner doesn't have to know about and you can control.
Thanks. Thanks for asking. If it's okay, can I go check on the kids now?
No problem. So, what did you think about what you saw?
I think she looked relieved to have information and to get her pills. And I see how you kind of kept to the facts. I like that.
Okay, so circle back around if you have other questions on this or other stuff comes up. But your experience is one that really many staff have had to work through, but once they did, they realized that starting a conversation about emergency contraception was really helpful for the woman that we were working with, not something that was a burden.
Thanks.